What the Lean Six Sigma and crisis management have in common? You're going to watch this episode of Mic Drop. Hi, welcome everybody back to another episode of Mic Drop, Insights and Lessons from CI Thought Leaders. My name is Gary Cox. I'm your host, and I'm also the author of the book, Cultivating Champions of CI, a Leader's Toolbox for Creating a Continuous Improvement Culture. Today, my guest is actually on the other side of the Atlantic, not too far from where I was born, in just outside of London, England, and we connected through LinkedIn. Her name is Yolanda P. I'm going to get her to pronounce her last name for you because I can't do it very well. And Yolanda is a Lean Six Sigma expert, and we're going to talk about the topic around rapid response to crisis management and how we're going to deal with that. So welcome to the program, Yolanda.
Thank you so much for having me, Gary.
It's exciting. So tell the folks about you. Tell them your last name because I didn't do a very good job of that, and a little bit about yourself.
Thank you. So my name is Yolanda Pereira. Pereira is a very difficult Portuguese name because there's too many R's and P's, so completely understandable. So I've been living in London for more than 2 decades, but I'm originally from Portugal. And I've been involved with Lean Six Sigma all my life since I graduated here in UK in economics, both in different industries, the shipping, logistics, finance, healthcare also, and education. So yeah, that's a little bit about me.
So you've done talk about healthcare. You've done quite a bit of work in healthcare. Tell us a little bit about that work.
And that's why at Northway Park Hospital, we had this grand visions and dreams in terms of let's train everyone within the hospital, which the knock-off effect will create a culture of continuous improvement. So if a crisis happened, we are prepared, we'll know how to approach. The crisis happened a bit earlier than we expected, but I'm really pleased with the way the staff in the Northway Park responded to such a crisis. They were amazing. Within that time, actually, I also moved to Johnson & Johnson. So I literally was in between. So I was a couple of months during pandemic at Northway Park, and the rest at Johnson & Johnson, a complete new environment. Some I had thought I was a bit crazy joining a company during pandemic where people were losing jobs, but I thought, why not? Let me try it. And again, it's about our people being empowered and given the right tools and mindset to actually approach situations and crisis. Is the quick response, but you need to have that long before. You need to invest on your stuff. And that's the key, investing on your stuff.
I would think in your environment, and I know that I work with a lot of clients that the use of a failure mode defect analysis or an FMEA is kind of a key tool in their arsenal for crisis management. There's kind of crisis prevention, I would almost say, more than crisis management, right? You create a strong FMEA, and the reason you do that is because you want to try to avoid a crisis. So where was the FMEA in your toolbox and in your path of teaching?
Mm-hmm. For COVID, we didn't use that. But for example, when implementing a digital solution, so Epic or the electronic patient records, that's something we always bring because it does require more attention, more detail, it's a bit more complex, and it's important to have that in place. And then actually bringing everyone together, putting that in place and trying to understand what are all the risks, what are the mitigations, what needs to be in place. That is key. I do feel that for every single digital solution that we need to put in place, FMEA, you definitely need to do it. But it is a much more complex tool that I feel that when you need to make a quick decision on the spot, it might not be yet the best because it does require time. It depends on what project you're or what type of situation you're working, I would say.
Yeah, I agree with you. The FMEA is, like I said, more of a prevention tool. It's not a crisis management tool. It's a crisis prevention tool. Here, you achieved significant reduction in collections. I'm really curious about that project, about, because obviously that's a big piece of collecting revenue or undue accounts or whatever. Is this something that you did as well?
Yeah, so that was actually early in my career. It was not only early in my career, but also my Lean Six Sigma career. It was when I've graduated here and I moved abroad to work for a shipping company, APM Terminals. And before I got promoted to the finance, where I was the head of accounts receivable and thus the debt collection manager to reach that target. It was a very interesting experience because the culture is different. So, and not just the culture of the country, but the company itself. The company was owned 50% by Angolans and the other 50 by Denmark. So you had two completely different cultures on trying to deal with a process that they don't see eye to eye. And it involved a lot of stakeholder management on my side, not just process, funny enough. So even though the process, for me, the process, designing the process was the easiest part. So I knew where I would look at the audits. I will try to understand the account, the revenue control, try and see where are the leakages. Great, who are the biggest debtors and why? I look at the contracts, try to see why are not they being reviewed? Why is there no system? So that all that part, I work with my credit controllers. It was actually the easiest part, I would say. Normally people would say that was the hardest part, but actually that was the easiest because I had a great team. Even though they were quite new to Lean Six Sigma, but because of my previous role, they knew what baggage I came in with Lean Six Sigma, so they expected me to train them and show them how to do it. So they were willing to learn, listen, and apply. And because I was the leader of the department, it's much easier for people to follow, right? And in terms of resistance, there's always a little bit, but it's easier when it's part of your team. The hardest part was actually dealing with the client themselves because the clients belong to a part of the government and they were used to not paying for years and years on end. So that required for me to understand not only the culture, but understanding who they would listen to. Again, the process was the easiest part on this. I don't think it was much of the Lean Six Sigma tools that helped per se. It was more to do understanding the type of stakeholders, the type of the type of people, personalities. And now that I'm saying that, actually did involve, because Lean Six Sigma, the main base is respect for people. I had to find out what was actually valuable for them. What is it in it for them? So in that sense, it involves a lot of the commercial negotiation, the sales pitch. So it involved that. And then inside internally, we had the mechanisms to understand where is it that in our system, why were we not picking up that people were not paying on time? Why the contracts were not being reviewed? Some contracts were not being reviewed for 3-4 years. And I was quite surprised at that. But because the other side of getting these customers to pay, I had to really literally sweeten them up a little bit
Mm-hmm.
to get them to pay, which is quite interesting. But it's to do with the culture. They were used to that. In the Angolan culture, a lot of times before doing a business, you need to take them out and talk to them, the Angolan side. But the Denmark, they see that as being wrong. So that could be considered fraud. So there was a fine balance between those two to get the process moving. But the type of tools in Lean Six Sigma that we did use is ensuring everyone in accounts receivable had to be trained on how to identify leakages. So visual control was definitely a big part of it. The all folders, I applied the 5S. I love 5S. We had to apply that throughout all folders. So straight away we could tell something was out of place or not reviewed. The fish bones and the 5Ys was more the brainstorming. So I created a lot of team building exercises where I used the tools just to talk about things through. So that really helped, having those tools. And just that concept that we need to keep going back to the process and review and improve. Because again, I started with a mindset. Just because we fix it today, that doesn't mean in 6 months we don't need to review it again, because waste will be added to the system.
Well, I hope you enjoyed that episode with Yolanda P. and look forward to the next one. If you enjoyed the episode, make sure you give us a like, thumbs up, and sure to subscribe. Add your comments. We'd love to hear what you have to say.